Most Americans are going online using a mobile device, and it's inevitable that health is going to be part of that.
It's interesting, people talk about developing and developed markets as if they're alien to each other. If you really start thinking about the development of global markets, is how do you find patients or doctors or providers that are in similar circumstances wherever they are in the world and aggregate them across a market.
So even at a rural village, a grandmother has a mobile phone, a young boy has a mobile phone. And because of that, we've come up with a lot of applications that would have never been thought of.
You know, having worked previously in Kenya and Tanzania and in India and in Nepal, Belize, Guatemala, the same struggles existed.
We started to work in mobile health because of the end users. I met community health workers who were walking 60, 80, 100 miles to access clinics, and patients who are walking the same distances to access care. And these gaps could very clearly be bridged by simple mobile tools.
Back in the day, I was a Peace Corps volunteer, served for 2 years as a translator for U.S. doctors that would come and do free clinics and free surgeries in the Dominican Republic. It was there that I heard a very common story from physicians, which is that most people in emerging markets suffer due to a lack of simple health information.
On the other hand, we have hardware, software, middleware, and pardon my arrogance, we also have brainware.
So what we have to do is we have to develop a technology and a solution to a particular market and to a particular need and a particular disease. And if we want to try and leverage that in a different market, we have to do that, but we have to be careful because we can't just assume because something has worked in one situation, that's going to work in another situation.
If you want to do cheap diagnostics, the idea that your power communication screen comes from the mobile phone, and then all you have to do is sample preparation and signal detection, and then that whole back end is just sitting there for free. It's clearly a huge win, and there are some things that aren't out there saving a lot of lives today, but actually some of those diagnosis things, malaria, TB, some of those are probably going to be the first where you can actually assign a number and say, wow, without this mobile phone application, those people would have died.
There's a lot that happens in a cough. There's a lot mechanically, a lot physiologically, and all of those changes that occur within a very brief period of time produce very sophisticated and complex sound patterns, and we're analyzing those to see if we can figure out the differences that occur in illness versus the normal state. We've already been labeled the iCough people. Our real interest is in using this in the developing world.
When I first thought of mobile health, it seemed to me that it was something about science fiction and not really what it seemed to be.
We are developing an open source platform, a medical platform for Android devices, both tablets and phones. And what we want to encourage is collaborative, data-driven, locally led healthcare, especially in developing countries. And we feel that an open source medical record platform is a useful centerpiece to this, but it's not the entirety of the solution.
In the President's conversation with the villagers in Rajasthan, he communicated a message that was far better in his words than mine in the importance of mHealth to our overall strategy. In fact, the President used that opportunity to specifically say that in many areas, even here in the United States, it's hard sometimes to get to a hospital, he said. And to the extent that we can use technology to provide people with basic health information, and in some cases simple diagnoses that can save people time, it can also save the government money, and more importantly, we can end up with better health outcomes.
It's the teenager who doesn't get access to HIV information or any information around family planning or sexual health. It's the mother who doesn't understand the importance of breastfeeding.
So when I think about the biggest impacts, I think of patient reminders, not clear, but if you could get people to take TB drugs regularly, if you could get them, even in the rich world, to take medicines regularly, remind mothers to do various things, particularly in that first year of life, that's a huge one.
Oh, that's what it sounds like.
Don't forget to take your morning pill in your light blue glow cap.
And then we ask them why.
Will you take your medication today? Press 1 for yes, press 2 for no.
And many people do tell us why.
Why aren't you taking your medication today?
Some people say, well, mHealth is really going to happen in the developing world first because it doesn't have the legacy barriers that exist in the developed world. And that's true. Some people say, no, it's going to happen in the developed world first. I think it's going to happen in both first. the actual uses of it, the business cases, those will change depending on the country and depending on the policies of that country. So I think we'll see a very rich mélange where at the end of the day, the research will come from the globe, which will help drive solutions.